We are at Holland Hospital's brand new Hudsonville facility. This is a primary care facility. Talking to Sam, he's one of the administrators here. Sam, why did you choose Hudsonville? Why here?
Holland Hospital chose to put another primary care facility in Hudsonville because Hudsonville is one of the third fastest growing communities in Michigan, and we recognize the need for continued primary care services throughout the region. It's estimated that we'll need up to 800 new providers in the state by 2030.
So Sam, talk about some of the services that patients will be able to get here.
In addition to primary care services, we have radiology services with mammography, x-ray, and ultrasound. We also have an on-site lab where people can walk in for to have their blood work done or have done after their appointments.
So let's talk about the convenience of this facility, how easy access it is, and how it's going to make life easier for a lot of your patients.
Yeah, our patients that are local to Hudsonville or traveling through, they're able to walk in for x-ray services. They could walk in if they need to have lab work done, so they don't have to travel to another facility, travel to Holland. They can get their services done right here in their hometown.
So you 3 new providers, that's a huge deal for people here, because I think we all have experienced how hard it is sometimes to get into and to establish a primary care physician. I mean, that's a big deal.
Yeah, absolutely. So we're aiming to make that process easy for everybody. We have new patient scheduling is available to start scheduling patients now. We're already filling up schedules, and we have same-day availability early on for patients in both the practice side and radiology and lab. Okay. As our medical group looks to capture our whole community, we recognize that Hudsonville is kind of the next step in that direction, where we currently have facilities in Saugatuck and up to Grand Haven, and Hudsonville is an area that a lot of our community members work. A lot of folks travel in from Hudsonville to Holland for their jobs. So we know that we can address the needs that they have here with our facilities in Holland and Zeeland.
And we've got Dr. Mary Meir here with us, one of the new practitioners here at the Holland Hospital Hudsonville location. Kind of a homecoming for you.
Yes.
Let's talk about your history and you coming back home.
Yeah, so I grew up in Grand Rapids, went to Grand Rapids Catholic Central, graduated from Michigan State's College of Osteopathic Medicine, went down south for a while, had a couple different jobs in different states, and have just kind of been making my way back north.
Wonderful. Well, we're excited to have you here. Let's talk about your feelings about being here, this brand new facility, and being able to take on new patients, because I know for so many it's such a struggle.
It is, and I'm very excited. Having this opportunity to work for Holland Hospital is great. I've worked for some very large corporations, and being able to get back to a community-style hospital where they really care about not only the patients but the providers has been very exciting.
Wonderful. And let's talk about, a patient's necessity of having a primary care provider. I think a lot of people think, well, I don't really need a doctor, I'm kind of healthy, whatever. But the importance of having someone who you connect with on a regular basis.
Yeah, we're here to be able to make sure that you are doing all of your preventative health care screenings, making sure that even though you feel good, you also are good on the things that you can't necessarily see or feel all of the time. That's one of the big things we do here in primary care. Is our goal is to make sure you're staying healthy, make sure you're doing things to prevent yourself from getting unhealthy, as well as then if you are catching that in an early stage, because that's the best way to find it.
Okay, perfect. And so you're taking new patients right now?
Yes.
So people can call and make an appointment?
Exactly, yes.
All right, wonderful. Any parameters? Is it just kind of everybody?
Nope, it's everybody. So as a family medicine practitioner, I see everybody from newborns, the youngest of the young, to the oldest of the old, and everybody in between. I'm also seeing prenatal patients, so if you're pregnant, I'm not doing deliveries, but I can take care of you up until a certain point for your prenatal care.
So let's talk about some of the services that patients will be able to receive all under this roof here.
Yeah, so in addition to primary care and talking about diabetes, hypertension, high cholesterol, all of the preventative health things, we also have a diabetes educator. We have behavioral health services. In addition to, they can get their mammograms here, x-rays, lab work done so that they don't have to go out. I do a wide variety of things, so that doesn't mean that you necessarily just automatically have to go see a specialist. I can take care of a lot of things in-house. I do some small in-office procedures as well, so a lot of things can be done here in this office, so people don't have to make separate appointments and do additional things and go other places.
Wonderful. Well, it is so nice to meet you. Thank you so much, Mary, for your time, and welcome back home.
Thank you.
And of course, you want more information, you want to make your appointments, we will have all of that information on our website, fox17morningmix.com. You want to check out this beautiful new space? There's a community open house coming up Thursday, January 9th. It's from 1 to 3 p.m. It is at the Holland Hospital Primary Care, that brand new space in Hudsonville. It's 3440 Chicago Drive, Suite 105. Or you can just call and schedule an appointment. That is happening right now, 616-394-3200, or visit hollandhospital.org/Hudsonville.